waiting. There was a delay. There was some sort of emergency. But we can see Ernie. Hey Lily, you must have a thing for horses with blazes.
With blaze?
This is like a big blaze. He's also got a blaze, right?
Yeah. No,
that's what you call that, right?
No.
That streak on his forehead?
Strip. He looks just like.
What do you call that?
That is called a stripe. Blaze? He doesn't have a blaze on his forehead.
He doesn't?
That's a strip. Peaches had a blaze. You know how Peaches had a big strip?
Blaze doesn't have one of those on his forehead.
He does, but it's not called a blaze. It's called
what's
a
it
strip.
called? Okay,
It's called
strip. You have a thing for horses with strips.
No, I just found him and he seemed like a good horse, so.
Here's an update.
Senior horse.
Hey, they're ready?
They're ready.
Okay,
You guys are looking to buy
Yes.
Ernie.
Pre-purchase.
John's looking to sell.
Correct.
Yep.
Okay. Cool. What do you know about him? What are we doing with him?
We've rode him a couple of
I
times.
think we're doing a basic
Okay.
PPE, and then we wanted to do blood to see if there was anything with the system, just because we had a bad experience with another horse.
Sounds good. We can go, we're going to flex him up, we're going to put him on some different surfaces, lunge him. We usually do a little neurologic assessment as well. We're looking his eyes, and we'll pull blood for the drug test.
Right.
That's all good. And then...
Oh, and he also needs a Coggins, yes? We were going to do a
So
Coggins
Coggins
as well.
test, that's
Yes.
a good thing. Yep. And that's all part of like a normal pre-purchase.
Right.
And then beyond that, then it's, are there any images that we should get? Do we need to x-ray this, that, or the other thing? Have we seen recent images of him so we don't need new ones or any of those things? Have you seen any recent?
No.
Cool. I don't know if there are any recent.
I don't know.
Okay. And then, but for
I
our
guess
purposes
if you see something and you're like, we should image that, then we would like to know that.
And there'll be some things as we go along, right? So this is the most thorough physical exam the guy's hopefully ever going to have, right? So we're going to talk about a lot of things that are hopefully white noise. They're not like, well, I got to tell you about them because they're there, but it's not really a problem.
Right.
But just so you know what I'm seeing.
It's going to compete with him. I don't know what you call it.
Tell him, Lily.
I want to do some hunters, eventing, and jumpers.
Okay, cool. Sounds good.
She knows what she wants. She knows what she wants.
And you want to enjoy your horse. I hear you.
Correct,
Okay.
yes.
Someone that knows what she wants.
All right, good
Yes.
deal. And have you ridden him? What do we know about
I've
him?
ridden him twice.
Ridden him twice, and he was pretty cool. Obviously, we made it this far.
Yeah.
That's good. All right, good deal. And I saw in the paperwork you've had him for about 8 months or so?
No, I've been with this horse about 2-3 months, but my friend has been with him for about 6
You've been aware of him for that long.
6 months.
Okay.
Yeah.
Cool. And he is in full training, or what's he?
4 or 5 days a week working. Appears to be good.
Okay.
So we'll see where it goes.
Sweet.
Yeah.
All right, we're gonna park him right here just so we can kind of work around him. Hey, big man. How are you doing? I don't want to be in your way there either.
No, we're all learning here. What are you looking for, Harold?
Just checking his teeth and making sure he's got a good bite and the right number of teeth and that his teeth match the age and whatnot.
You can tell how old he is by his teeth, huh?
Give or take, yeah. And he does not have a tattoo, which fits with him being unraced. We'll check his microchip, because some of these guys, I heard you beep somewhere. Sometimes we're migrating away from tattooing horses and now just more into microchips.
Where would his tattoo be?
On his lip. Yeah.
Well, it's the only place you can see it again.
So what's that?
That's his microchip number.
Oh, okay. Oh, wow.
Well, we were curious about the number. Now you have it.
There you go.
So there's a microchip number in there.
Yep, so he does have a
Wow.
microchip. And we'll...
What does that mean? Just that if he runs away, we can find him, or if... Like, I have no idea.
Really, yeah, it's more of an identifier.
Okay.
Right? It's like him carrying his driver's license. So that should be registered somewhere. If not, you can register it, and then at least it's there. And it'll be in your records, such that it'll be feasible that you can compare if anything ever happens.
Okay.
You know? Let's say he goes missing. And for, show purposes and whatnot, often they'll use that as his identification.
Okay.
You know how to take a heartbeat. Yep.
Well, I listened to him for the last
Are
2
you?
minutes.
Is it?
Yeah.
Is it speed,
So he has-
or do you
yeah, so he
you
has
listen
a
for
good-
consistency,
He
or
has
what?
a good normal heart rate.
Okay.
The rhythm is normal. And
Okay.
The sounds are all appropriate.
Okay,
Yeah.
so speed and rhythm is what you're looking for. Sound.
Yeah, no murmurs or arrhythmias or anything like that.
You are pretty.
Easy, little one. Easy, easy, easy. There he goes. I allowed you when I felt Peter's lower back there. We'll keep that in mind as we go.
Is that a little
along.
sore spot?
Yeah.
Is that right? Is that right side?
Yeah.
Right rear. That's what Lisa said. She was concerned about was right rear.
Really? On him? Just by watching it? Wow.
So Lisa's her right
Okay. Lisa who?
here. Lisa Tygaleski.
Okay. Where are
You
you
know-
guys from?
Fletcher. So we're up near Asheville.
Cool. I think my next three pre-purchases today are from Hendersonville and
Wow.
Fletcher. So.
Wow.
And
You're just pinching nerves there?
I presume the goal is that he's going to be a long-term horse with you guys,
Yeah.
Correct.
rather than like resale or anything.
Correct. Yeah, I mean, he'll live on our farm with us, and we'll trailer him to her lessons.
Cool.
Is that a normal reaction, or is that a sensitivity?
A little sensitive to his lower back palpation.
Look at
More on
that.
the right than the left. He's a
Wow.
good boy.
Okay.
Quit now.
How do you know he's not going to kick you?
I'm just playing my bets. I don't. So, I don't ever-
So we have.
If I were him, I'd kick you.
We have cows and sheep and pigs, so like, it's just, I mean, we feel pretty comfortable around animals, it's just horses.
Oh yeah, there he goes.
And when you ride him and stuff like that, like he's plenty gentle and quiet and everything.
Yeah.
Yes.
No, right? He's like, I've been waiting for an hour. Now you're touching me. My goodness. Thanks
It's
for,
also a little cold.
thanks for your patience today, guys. So we're tied up with some unprogrammed scheduling or unscheduled programming.
Are you feeling for anomalies there?
Yeah. Yeah, feeling for sore spots and swellings and scars and whatnot. You got ears half the size they're supposed to be.
Is that right?
I mean, proportionally, they're little cute fuzzy things. So.
Yeah,
You know, if he's had a wound
Mm.
or if he had some procedure to his head,
Okay.
he's got normal airflow through his nares and whatnot.
Is it bad if they have a scar on their head?
Well, horses are notorious for putting their heads places they don't belong. It's kind of a coincidental shape and location. So if I turn him just the right way, I can almost make out that there's a rectangle here.
Mm-hmm.
Yeah.
And that's a great location for somebody to have done a sinus surgery on him. So I'm kind of wondering if it's not obvious. I don't know. Brittany sees enough of these. What do you think, Brittany? So you got this guy that makes a corner right here, and then the landmarks for where I make my incision when I do those is the medial canthus and the supraorbital foramen, and then if I smooth the hair down, like there's just a little ridge that connects the two. Man, so it's not a home run, but it's a coincidental
Is that bad for
rectangle.
you? Something like that?
It kind of depends on what was in there. And I mean, it looks like it obviously isn't fresh. It's been a while. If that's what that was, versus, I mean, horses bump their foreheads and get scars all the time,
But did he have well?
It did heal really well. I mean, yeah, I guess I would give him that if that's an old flap. It's called the sinus flap when we do that. It's it healed beautifully.
Why would you do that surgery?
Lots of reasons. Whether it's some sort of sinus disorder usually. And so whether there's, whether he had a tooth problem or whether he had a cyst or an infection or a hematoma or all sorts of reasons.
Okay.
And some of those are no big deal. Some of them are not as low invasiveness.
Temperature?
94.7, which is a little bit low, but he's kind of he's got good tail tone, but his anus was a little relaxed there.
Yeah.
So he may just have some air influence.
What kind of influence?
Air.
Oh.
It ain't 94 degrees out here.
It's pretty cold.
Yeah. It might be 98 degrees in there, but you let some of this air in there and it'll cool it down. We'll squeeze his feet, see if he cares.
Yeah.
Much there.
Looking for a sore foot now, huh?
Yeah.
So it was in January. Perfect. Because
Where'd you go?
What do you think? Can you tell anything? Can you see any concerns?
Yeah, it looks.
We're going outside.
I shouldn't say that. He just has probably.
It's a damp cold. I thought South Carolina was warm. We came off the mountain. It's cold.
got you. Yes, that makes sense.
So how was the lunge?
Lunge looked good. He is correct about things. He's a little stiff on the inside hind limb, but fairly mildly, pretty subtly. So now I just watch to make sure he knows where his feet are going.
Come on, buddy.
Written by Lily Rose.
some hay.
I really don't have anything.
He's checking you checking flexibility there?
Yeah. See what his range of motion is there.
See if he's gonna be able to give you a hug one day.
Needs to limber up his neck a little bit. A little better over here. Yeah, there you go. There you go.
We didn't know the manners, you know.
Yeah.
So you should take him inside, and we're going to go into a dark room so I can look in his eyes.
Okay.
And so we can step over that way. We'll just follow him. We're going to get him wavy too.
Guesses on how much he weighs? Any guesses?
I'm gonna say 1056.
I'm gonna say
I have no idea if that's right.
I'm gonna say 900 pounds.
900 pounds for what?
How much he weighs?
I
You
would
wanna
weigh more than 1,000.
Okay.
It's more than 1,000.
Oh wow, where are we? You smell alcohol. I smell alcohol. You looking for a dilated? Does it dilate like ours?
It does. Yep. So making sure that his pupil works and his cornea looks okay and his anterior chamber looks okay, and look in the back of the eye at the optic disc and make sure that looks okay. And we can look at his third eyelid here, make sure it looks good. Horses have a third eyelid just like lots of other species to protect their eyes from when they're grazing and whatnot, that they don't get seed pods in their eyes and stuff. We think, I don't know, I wasn't there, but we think it's an evolutionary thing.
So many stories like that. There was one we used to have.
Alright, so we'll get some blood from him here. There's his vein.
You can see it.
Yeah,
That big?
it's that big.
Like half inch?
It's closer to an inch or so.
Was it? Jeez.
Seems to be pretty tolerant.
He's pretty tolerant.
Really well. I mean, like, I get my blood drawn pretty often, and I'm like,
Alright, he didn't even have to sit down.
he didn't even flinch. Like, his eyes didn't even go.
Okay, gonna weigh him. Whoa.
Told you he's more than
1056.
You were right. You were right on it.
I
did you
told
say?
you over 1,000. I said over 1,000.
Yeah, but she's.
I know, I said
1056
1056 though, baby girl.
15 pounds off.
So I'm the winner.
We ordered more testing, just to be sure. There are some things, so we want to go into this based on the last one, our first horse purchase. Eyes wide open, or not at all.
Right.
That's our approach, right, Rebecca?
I think so. I think that we're just, after what we went through with the last horse, not Blaze, but Peaches, we just want to make sure that we can manage anything that could be wrong with him, because if there is something wrong, then we need to know.
And if they find something, if they don't find anything, then it's likely that we can manage, you know, the soreness and the
Right. If it's that, or if it's something else.
lethargy, the conditioning. We can address all that thing, unless it's something major. So we're getting tested for that.
Right.
X-raying right now. He's done. We can come see the rest of the exam.
Well, so I didn't shoot him all. We shot the back first. And so this is his withers. So he's going to be looking that way, and his rump is over to the right.
Okay.
And so this is his withers. And this is what I was saying. You can't see like the whole spine, but you can
Right.
see these things that are called the dorsal spinous processes.
Uh-huh.
And they're like the little shark fins. Each one of these comes off a vertebra. And
Okay.
so this is moving from his withers. We're going to move back down the back. And normally, this is a normal shape. You know, this is all kind of normal shape. And normally the spaces do get a little bit smaller as you go back. But what I run into is he's got a lot of, this is by definition kissing spines, where he's got.
That's what Leslie just said.
Whoa, Leslie! She's all over it.
She is. She's
Leslie
crazy.
said.
So, yeah,
he
he's
could have
got
kissing
some
spine.
overriding of the processes, as well as this is some irregularity of the bone, right? So there's bony resorption and remodeling,
Okay.
where the bone is actually responding to the abnormal stresses.
Okay.
So, kissing spine is not a definitive deal breaker in a lot of cases. And there are a lot of horses out there that have some degree of bony pathology in their backs, and they can be managed and they can get by. And that's physical therapy, sometimes injections, sometimes shockwave, massage, acupuncture, all these other things you can
That I want to do for my body.
Right? Yeah, exactly. And, some horses can make, there's a surgery you can do to help make that management easier. But at the same point, if you're looking for a horse that's not going to need management, this increases the risk that he's going to need some help in order to try to get him to fulfill what you want out of him. Right?
Yeah.
Like this increases your
Are
risk
there
of failure
horses
quite a
that
bit.
don't need management at the $10,000 range? Or is that a low end range?
Or are we like looking
I don't
for a
mind
unicorn,
being
basically?
I guess what I'm
I don't
asking is,
mind
all
extra
horses
work.
going to need a management?
It's not that. It's the cost.
Well, for what we're going to
associated
ask them to
with
do,
it.
they're going to need some version of either physical therapy, which is just fitness, and like taking care of them,
Right.
Yeah.
all the way up to injections and stuff like this, right? So I mean, and that's going to be like, it's a whole lot easier to do a low-level job than it is to go to the Olympics,
right.
But at the same point, can he get done a low-level job? To me, this would be a guy that, if you're happy with this horse as he is right now, maybe he's gonna be okay. If you're gonna ask him to start doing stuff over fences and cross country and all that kind of
She
stuff,
just told me she wants to jump 4 feet
Yeah.
within 2 years. That's not happening here, yes?
it's gonna be hard.
Yeah.
I think so. I didn't X-ray his leg yet because to me,
You were
Yeah.
like, this is
this is we
information.
need to talk about.
This is the
This
information
must
that
be
maybe is causing
deal breaker.
all of this.
Yeah, this could
Okay.
be a reason for primary back soreness, as well as him not wanting to round over and canter, as well as him not wanting to engage his hind end.
Okay.
Okay.
Could it also be the reason why his withers are stuck?
Yeah. If he's
Wow.
not using his back because it hurts, then he's not building these muscles. Yeah.
Okay.
Hey, big boy.
We've had a conversation about it already.
Oh, Lily. Oh.
Okay, we'll call Miss Leslie.
We are home. Ernie has kissing spine. I don't remember. Did I capture that on film anyway? I don't know what kissing spine is. I'm learning as we go, but it's a deal breaker. It's probably why he was sore on his back, I guess hip, lower back. It's probably why he's a little more lethargic, and it's not laziness. It's just, I imagine he's in pain. And then, hey there. So that's a deal breaker. But I'm so happy we went this step further, because we did have to order those x-rays. That wasn't the original plan. It was going to cost more money. But the good news is they did the x-ray first, and so now they don't have to charge us for the blood test. Very good vets down there at the Tryon Equestrian Hospital. Not every story ends with a happy ending.